Welcome back. If you're a new mom or you have menopause-related problems, listen up. There's a new procedure that is gaining attention around the country that can help out. It's called ThermiVa, and to teach us more about it, Courtney Albritton is here from the Physicians Clinic of Iowa. Thanks for joining us.
Oh, thanks for having me.
What is ThermiVa?
ThermiVa, to put it really simple terms, this is a device to help kind of with vaginal rejuvenation. We notice a lot of changes as we get older everywhere in our body, but a lot of females notice changes that happen down below too, whether or not that's externally, kind of the cosmetic appearance to things, but also internally, especially after having childbirth or going through changes like menopause.
So you actually brought a tool to show us kind of how it works. So
Sure.
Would you explain?
Exactly. So what this is a handle that we kind of use. It delivers radio frequency energy, which essentially is just going to be gentle, warming, kind of heating of the tissue. And we're able to do that kind of externally and internally. And what we notice is that when we use this technology, for one, it's painless, which is nice. But for two, it stimulates collagen down below, so it kind of tightens and tones everything. So we get benefits both externally and internally.
That's so crazy. How do you know this kind of the science, or how does this even possible that something kind of like heat would have those kinds of effects?
You know, we've had this technology around for more than 3 years. We've used it a lot for cosmetic type things, tightening of the face. You know, we have a lot of things around the eyes and the mouth area. It's just that we're now able to apply it for not only cosmetic, but we're also noticing some functional benefits as well with this. So
Very good. Okay, so how many times do you have to get it done? Is this like you come several times, or is it just once?
great question. So this is going to take about 3 treatments. The treatments themselves only take about a half hour. And like I said, we're just warming the tissue. It's just nice and gentle. There's no downtime involved with this. And it's something that you have to come back on a monthly basis for those 3 months.
Okay, so do you know how long after you've done the 3 months, and then from there you don't have to go back anymore, how long will it last?
Well, you know, we can't necessarily affect aging and gravity. So we're always kind of fighting those two things no matter where we're at in our body. But, you know, for cosmetic appearances, we recommend touch-ups maybe about once a year. For stress incontinence, we're noticing a lot of urinary benefits. We have patients within 24 hours of this procedure able to go on one of those trampoline parks with a full bladder, finally able to enjoy it with her children. So it made such a quality of life difference.
This is huge, and this is something that a lot of people don't talk about.
You know, it's amazing. So I've been in women's healthcare as a provider for over 8 years, and this is a conversation that a lot of women, they think about, but they're so embarrassed to have with their provider. You know, it's kind of risky to kind of talk about it, especially when it starts affecting, you know, sexual intimacy, and it starts affecting your partners as well. And so this is a conversation that just needs to happen, so we're just bringing it out into the public.
Very good. Thank you so much for joining us. There is so much more that we could ask and talk about with this, but if you would like more information and how it can work in your life, you can contact them at PCIplasticsurgery.com. They also have a Facebook page. It is Dr. Andrews Plastic Surgery, and we sure do appreciate you talking with us and for talking. This is very interesting.
All right. Thank you very much.